Well, anyway, this talk is about Obamacare. It's the law of the land. We've got it. We're stuck with it at least until, well, probably through Mr. Obama's third term, which I haven't completely ruled out the likelihood of. And there are a lot of things in there that are pretty scary. Initially, when the bill came out, I read the entire thing, almost died doing it, and it took a long time. And I understand why Nancy Pelosi said we have to pass it so we can know what's in it. But the sky really is falling, and I'll tell you why, and you probably already know. You know, how Obamacare will kill you, and it's scary, but it really will. Next slide, please. Who said these things? How fortunate for governments that the people they administer don't think. Make the big lie, make it simple, keep saying it, eventually they will believe it. By the skillful and sustained use of propaganda, one can make people see even heaven as hell or an extremely wretched life as paradise. Well, we've been built, those were quotes by Adolf Hitler. And I'm often, you know, accused of saying that Mr. Obama and current administration, it's hyperbole, they're like Nazis. I'm not saying that he goes and kills a group of people, but the way of governing is eerily similar. Go ahead. What about the AMA? It receives $100 million per year from government-mandated functions. They do publications. The government provides the lion's share of their revenue. The AMA is not your friend. It's not the friend of doctors. Only about 16% of doctors now belong to the AMA. It's just, so when the AMA says something, you got to start worrying about it when they agree with it. Next. Problems with U.S. healthcare. We all know what the problems with U.S. healthcare are. I mean, it's prohibitively expensive, and people believe, a lot of people believe that it's the free market that caused that. It's not the free market that caused that. It's government intervention that caused that. We haven't had free market medical care in this country since 1965. When insurances started in the United States, the first down in Baylor, the government couldn't wait to get involved. You used to be able to buy hospitalization insurance for an entire month for 5 cents when Baylor first started their hospitalization program. After the government got involved, it went up significantly. People expect that benefits will always exceed their costs. Yeah, you know, it really can't. Imagine if your house got caught fire, it was worth $300,000, you demanded the insurance company pay $1 million for it. It's just not realistic. People seem to think, and we all are guilty of that, but people seem to think that in all cases benefits will outstrip the amount of money they've put into it. That's not realistic. That's not how insurance runs. So we have to be more realistic to some extent. We reap what we sow. Medicare covers Warren Buffett with your tax dollars. That's how stupid Medicare is. Now, I'm not saying that you should all be thrown off Medicare. Medicare is necessary right now because of government-caused inflation of medical care costs. Now you need Medicare, you can't afford it. But if Medicare never existed, you'd be able to afford your medical costs just fine. Next. Ways in which Obamacare will kill you. Increasing the cost of medical care, which it's going to do beyond all ability to look at right now. I mean, you won't believe what's going to happen. Medical care costs and insurance costs went up nearly 40% last year. Prior to Obamacare coming, at least the penalties of Obamacare and the taxes, medical care costs were going up 7 to 9% per year. We couldn't stand that, so we had to make it 40%. Rationing care, forcing your doctor or hospital not to treat you, reducing the likelihood that a serious illness would be diagnosed in time to treat it effectively, limiting care for certain groups. I had to redo this whole thing because I couldn't find my other presentation, so it shouldn't say people groups, but anyway. The elderly, assigning value to your life based upon your age, what you will be able to contribute to society, the way that they look at it, and also whenever you get a medical problem. Delivering poorer care, delaying care, and promoting the use of abortion. Next. Why is medical care in the United States so expensive? We're going to hit that. It's this. I'm going to make sure that Oregon Right to Life has the entire presentation, so all of you will be able to get it, and then you can look through this in more detail. But I mean, if you look at it, government makes everything complicated. If you want to look up an article that I wrote called The Government-Funded $10 Tomato, you'll very easily understand, and I'm sure most of you are, since you're here, you're very intelligent, so you understand that anyway, how government causes an increase in the cost of medical care. Technology doesn't cause an increase in medical care. 30 years ago, 20 years ago, if you came in with belly pain, it couldn't be diagnosed, what did they do? Exploratory surgery. What's cheaper, a CT scan or exploratory surgery? Come on, people are just, they blame technology and they shouldn't. The proper use of technology lowers the cost of medical care. Cost of complying with government regulations. I have to be covered for pregnancy and delivery. It ain't going to happen. So why should I have to pay for my insurance for pregnancy and delivery? It's idiotic, really. Frivolous lawsuits, not saying that a doctor who screws up and a patient suffers shouldn't be sued. Not saying that at all. But the frivolous lawsuits make up over 60% of lawsuits. Lawsuits that where people, there was no other outcome possible, or there were multiple outcomes and the doctor really isn't at fault. What happens is, the lawyers would have you believe that the frivolous lawsuits really cause almost no effect on medical care costs. They're right. $5 billion a year, when you've got a $16 trillion deficit, that's nothing. But the cost of trying to avoid lawsuits approaches $400 billion a year. So it's those unseen costs in the fear of being sued that cost $400 billion a year. Incidentally, enough to cover all of the uninsured with decent insurance without government involvement. Very interesting. And doctor salaries. I want to draw your attention to an article in the Toronto Star, and you can look it up, where it said that in Ontario, where there's socialized medicine, primary care physicians were being paid as much as $700,000 a year. It is not the case that socialized medicine reduces the amount that's paid to doctors. It reduces the amount of effective care that's given. Doctors are paid less in some cases because they work only part-time. Cardiac surgeons will finish their allotted number of heart surgeries and they'll be off the rest of the year because there will be no more allowed. That means that they're going to be paid less because they do less surgeries. Their cost per surgery in Canada is higher. So $700,000 a year. I was ready to move to Ontario. Next. Costs will skyrocket under Obamacare, making care less available to all of you. It's really true. People don't raise costs, the government does. Healthcare, mortgages, and education, all the three things that the government's been most intimately involved in. What are the three things in this country that are more of a mess? In 1964, 1 year at a four-year university on average cost $1,400 a year. What did we get after that? Government aid. And by 1974, that cost was $6,000 a year. So the person wanted to go to college in 1964, they could pay $1,400 a year. By the time 1973 or 1974 rolled around, they were getting government aid and they still had to pay, what, $1,400 a year was left over. The government didn't do anything but raise costs and lower standards. Drug costs are but one example, and people are not told this. I've never seen this on the news. I've never seen this talked about in debates in the national media. Just one example, colchicine, vancomycin, which is an antibiotic, colchicine, which is used for gout. Colchicine has been used for gout since before there was hair. I mean, it's been there forever. It was about $10 a month for colchicine. The government decided, the FDA is a malignant group. The FDA decided that it had to, people can die from colchicine. So never mind the fact that in Florida, you are 3 times more likely to die of a lightning strike than taking colchicine. But they didn't investigate lightning. So what happened was colchicine, $10 a month, the government decided it was going to force, and next slide, please. That explains what happened, don't have time to go into it. After government got involved, colchicine is now $400 a month. People who were taking colchicine for gout on limited income, horrible. Vancomycin, we'll go to the next one, antibiotic necessary for vancomycin for methicillin-resistant Staph aureus. We give it intravenously. It was approved by the FDA in 1970-something. Vancomycin orally is used for a colitis called Clostridium difficile colitis. It's fatal if not treated, okay? Oral vancomycin, the FDA decided we approved IV vancomycin, but we need to reapprove oral vancomycin. Oral vancomycin cost about $50 for a course. It is now over $2,000 for a course of medication. You want to know where the drug costs are? Look at the FDA. Next. Oh, go back, I'm sorry. Yeah, vancomycin is your friend. So what I do, I prescribe the injection and tell people to swallow it. It's not even absorbed in the GI tract. It stays in the GI tract. So they go and squirt it in their mouths. All right, next. It works. It works. Obamacare was supposed to address the problems in medical care. It makes every single one of them worse. Even with Obamacare, greater than 20 million will be uninsured. The problem is insured doesn't mean getting care. it can't say that insured means getting care. So just because you have a card doesn't mean that you're going to get cared for. And that's the problem. So the number of people not getting care, called the effectively uninsured, is considered by at least the Heritage Foundation, and I know they're a conservative group, will increase. Previously it was about 3.7% of the population who could not get care because we have EMTALA laws, et cetera. And the Canadian effectively uninsured was 3.4%. So nearly similar, even though they've got a card. Penalties for patients are less than insurance, so many will do so, as they did in Massachusetts, simply pay the penalty and not pay for the insurance. Penalty for the employers is less than providing insurance. Reimbursements will not cover costs. Doctors will stop participating in Medicare and Medicaid. Average wait for a primary care physician is 50 days in Massachusetts. It's about 15 to 20 days elsewhere in the country on average. Massachusetts, look at Massachusetts and what happened with Massachusetts with Rationing Care. So I just really wish we had a better candidate last time. But anyway, I think you'll see. Next. Cost of Obamacare. Nearly 50% of the newly insured will be on government programs. We will be subsidizing the unreimbursed care of the people exempt from the penalty. And there are people exempt from the penalty, it's kind of iffy why they are. Obamacare will allow people who are uninsured to obtain insurance once sick, thereby not paying for it previously. Imagine, you go to Geico, the Geico Gecko guy, everybody's seen him, and you say, hey, listen, my house caught fire yesterday. I want to buy insurance to cover the fire. How many people think you're going to get insurance? Well, this is it. Your house caught fire, get the insurance, pay for it for a couple of months, get cured, and stop paying. So who's going to absorb the cost of that? You and I. Next. Obamacare will allow people, we already talked about that, insurance companies have to absorb this and you have to absorb this. It happened in Massachusetts. All 4 insurance companies went deeply into the red. What? They didn't make a profit? No, they went deeply into the red and they still are. They were able to recoup their losses because other states did not have Rationing Care. But when every state has Obamacare, where the insurance, the goal of this is to get rid of insurance for medicine and get everything to be federally run. Expansion of Medicare to Medicaid, bronze, silver, and gold, and platinum. The wonderful plans under Obamacare are going to cost you $15,000 to $19,000 per year. Now, let's look at that. And how is a guy who is like homeless going to spend they're still going to have to spend that for the most part unless they're on Medicaid. HSA, $3,000 deductible at $11,000 per year. So the most you'd have to pay is $14,000, and if you put that $11,000, the money into your account, at the end of the year, if you don't use it, you get to what? Keep it. But HSAs are not included in Obamacare, especially not under the new Oregon wonderful stuff. Massachusetts Care under Romney Care, 2007, $133 million, 2010, $880 million for Commonwealth care. Medicare was supposed to cost $9 billion by 1990. It cost $70 billion. Does the government ever get it right? Next. Great plan for the poor. We went through that. Most young families will simply do better paying cash. If you're a young person, you don't have many things wrong with you, you have to go to the doc, negotiate, pay $100. You got to get an x-ray, negotiate, pay $50. Why would you pay $19,000 a year for insurance? Most young families who do better paying cash, this is about control, not health care. Next. We cannot afford it. Unlimited coverage with no stopgap. Now that initially sounds pretty good, as we talked about, but it simply doesn't work. It's not realistic. Usually insurance companies have a $2 million or $3 million limit. And I'm not saying that people's, I'm here a pro-life thing, right? I'm not saying people's lives aren't worth much more than that, but the bottom line, insurance is insurance. You can't have unlimited insurance. Dependent till age 26, so care without payment. That sounds good too if you got kids that are under, but this type of thing is abuse. It's full of potential for abuse, and we're going to be paying for the care of a whole bunch of people who should get off their behinds and start working and doing something and paying for their own care. Obamacare, we went that 48% pay no income tax. Who do you think is going to be paying for this? Next. Now, we talked about, what I'm going through here is the ways in which it kills you. One of the ways in which it kills you is raise prices so that you can't afford it, and that's why we're going through all of this. How did Obamacare hide all these costs? The Class Act. How underhanded. People are going to pay for long-term care, which the government was going to guarantee. Now, luckily, that got struck down. $75 per day for long-term care. That won't pay for a toenail clipper in most places. And yet, and so people were going to pay into it for all these years, and the initial cost of Obamacare, because that money was going to be applied, was going to seem like it was less. Once that got struck down, that horrible thing got struck down, It went from $940 billion to $1.5 trillion over 10 years. Huge difference. Go up, no, down, or whatever. Next one. Hiding costs, Rationing Care, and we'll get back to that more. Push costs onto states, disaster. Can Oregon afford it? Well, Kitzhaber thinks it can. Reduce reimbursement, not costs, sustainable growth rate, increase taxes, adjustment of sustainable growth rate. So we'll see between hospitals and doctors a 30% decrease in payments over the next 2 years. Now, I want to make something clear. I am all for doctors making less money. I think a lot of us, maybe even me, are overpaid. Do it through the free market. Let there be competition. If Dr. Smith over there is offering a rectal exam at half the price, go to him. And the bottom line is prices will drop. We don't need television care to make sure television prices drop. I think if we had competition in the United States, prices would drop like a rock. All right? Making a majority of people pay for care they will never use, and that's really important, especially what Oregon's doing, which is just a travesty. You have to pay for approved plans, which pay for everything from, earwax pickers to stupid other stuff, and air conditioners, by the way. Everything's inflated. The cost of everything is inflated. You should be able to go and say, I just want a catastrophic medical plan. I want to pay $300 a month, and I want to pay if I have a heart attack. No, we're very sorry. We have to take care of your earwax. All right, next. Increasing taxes. So this goes through horrible increase in taxes, including increase in capital gains tax, increase in everything. Okay, so I won't go through because I got to hurry because I'm in trouble if I go over. So go ahead, up. Obamacare exchanges will blast the states. Again, must be government or nonprofit. Of course, profit is horrible. Qualified plans only, mandates. Pregnancy, I'm covered, so don't worry about me. Reproductive care for men, as we already talked about. Let's see, I don't remember what HAS is, so because I did this. People can get into the exchange rather than the employer. That's really important. People can get into the exchange, can get their care through the exchange rather than get it through their employer. But if they do, the employer is still fined. Isn't that nice? Participation, small business, big unions are exempt. Surprise, surprise, as Gomer Pyle used to say. Next. States exchanges, payment, federal government for 2 years. Well, that really does it, right? The federal government's going to pay for 2 years. And then after that, it successively, incrementally comes down. And Kitzhaber's, oh, wow, you get paid for 2 years. I mean, the guy is not thinking down the line. So then you get it down, and it's going to be about Medicaid rates. The states are already bankrupt. Fines, $2,000, insurance up to $19,000 to $20,000. A lot of people are going to choose the fines. And, as I said before, waivers granted. Okay, next. The real cost of Obamacare. Now, we need to look at the real cost because that's what's going to affect you in you trying to get medical care, and that's why it's going to kill you. When the total cost is taken into consideration, it'll cost $3 trillion more than claimed. At least. I'll make sure you all get some. Add the cost due to reduction in employment because of the fact that the employers don't want to burden themselves with all of this and drain on the economy, and we don't even know where it's going to go. Mr. Obama doesn't care about that. Once he's gone after his 4th term, he doesn't care. Next. Governor Kitzhaber or King Kitzhaber? Healthy Oregon Act. It's the unhealthy Oregon Act. It is the stupidest thing to ever come down the pike. Does anybody know why Governor Kitzhaber ran for governor the last time? He didn't destroy the state during his first 2 terms. He had a goal, okay? Oregon Health Fund Board, big salaries. Oregon Health Fund Board, these people they're being paid $200,000 a year. I want a job there to make all the decisions for the state. Coordinated care organizations, it all sounds really good. Oh, wow, we're going to have coordinated care. Well, what happens is they're trying to consolidate everything into districts and have complete government control on everything. And they're going to try to control everything, including education and other social services through the coordinated care. Pay attention to what's going on in Salem. It's scary. Everything will be under his control. Kitzhaber's going to run again. Of course, he said, I'm only going to run for 1 more term. Air conditioners are a part of the plan, as are a whole bunch of other things. Next. Let's get real. Okay, a lot of us have kind of expected a lot of stuff from the government. Every time you get a motorized scooter, and they go, yeah, you've seen this on television. I never expected never to have to pay anything for my motorized scooter. Well, the bottom line is when you get a $10,000 motorized scooter, somebody else doesn't get care for a heart problem. So I'm not saying that people don't need to get around. What happened to wheelchairs? I mean, my grandmother had a wheelchair. We have had Medicare spending money in areas it shouldn't to get votes. That's the only reason. We've been lulled into this, and even those of us with good intentions, caring about people, the elderly, the preborn, are getting lulled into this and taking benefits that we shouldn't take. Nobody's saying you shouldn't be treated for illness, but very few people need a motorized wheelchair they can zoom along the Grand Canyon. Medical care has lost direction. Obamacare and Oregon plans would make these problems worse, nothing more than payment for votes. Next. But wait, there's more. Medicare costs to cover it. Now think about this, just do the math. 48 million people, about $600 billion last year, with increases to $932 billion by 2020. That's an estimate, if you look at the growth, of $7 trillion over 10 years at the present rate of growth. Is it reasonable to expect that a healthcare plan that will directly cover 40 million people and affect everyone will cost only $900 billion over that time? I mean, does he think we're all stupid? Yes, he does. I don't even want to discuss Medicaid, but I'll show you a graph later. Additionally, it will add tens to hundreds of thousands of government jobs. You got to have people, I can't remember what they're called, facilitators or doodadders or whatever, who are going to have to get you through that. 30,000 of them in Oregon. I think it's 30,000 of them in Oregon. Yeah, more PERS. Yeah, we need that. When the costs related to regulation job loss, we already talked about that. Next. Medical costs over time. Now, if we look at the real numbers, okay, that's the graph of medical costs over time. There are times in the past, like when what? The HMO Act of 1973, Medicare, when things have gone up. But really, it hasn't been as bad as people think. Now, that doesn't mean we shouldn't fix it, but it hasn't been. Let's look at the next one. There's the graph of Medicaid costs over time. Next one. And I don't know what happened to my Medicare one, but anyway, it's the same. Government graphs, I mean, you know, costs for government things always look the same. They're like that, like ski slopes in reverse. Rationing care. Obamacare will kill you by rationing care. And they said there are no death squads. Well, you know, basically, it's like calling Adolf Eichmann a holding camp activity director. But in fact, you know, there are death squads. They're just not called death. Even if you call them by another name, you know. Next. Rationing and quality measures. Increases cost to document compliance with quality items and core measures. Now, what are core measures? Make sure that people, and it's not just that they have that required, it's that the government requires it. And you have to document it. It takes you 3 pages to document an aspirin. So what's going to happen? So core measures, aspirin with a heart attack, antibiotics with pneumonia. I mean, how many doctors don't give aspirin with a heart attack and antibiotics with pneumonia? We just never had to write 3 pages on it before. Everyone already does this. If forms aren't filled out properly, no payment. Rations care by slowing everything down, and the hospital gets fined if the forms aren't filled out properly. Next. Rationing, penalties for doctors and hospitals. Patient comes to doctor, has a cough, patient's a smoker, doctor treats the patient, advises stopping smoking, patient refuses to stop smoking, patient returns to doctor with bronchitis, the insurance refuses to pay. They have that right. Why? Bad outcome. What am I supposed to do? Go to the person's house and force them not to smoke? I can't do that. I don't have control over most of the outcomes of my patients, but I'm going to be penalized. That doesn't seem fair. Next. Effect on patients and docs. Well, you can't see it very well. That's my old office with my for rent or for sale sign there. Now, I had a wonderful practice. I enjoyed my practice, enjoyed my patients, but it got to the point, and financially I could have kept it for another 20 years, but it got to the point where I just refused to fill out all those stinking forms. It was either quit or go postal, and I decided not to go postal. Next. There are going to be fewer doctors, and all these are ways, these subtle ways that you're going to be killed by Obamacare, because you're not going to have enough doctors. The care that you're going to get is going to be by lower trained practitioners who are not going to recognize when you've got a real problem. You know, the great William Osler, who wrote the first compendium on the principles and practice of medicine, said, "The eye does not see and the hand does not feel what the brain does not know." Doctors will opt out of Medicare and Medicaid until it becomes a mandated law that they don't. Doctors will quit medicine. Medical care, your health and life will be in danger. Next. Canadian-style care. One of the hundreds of articles in Canadian newspapers that you can look up anytime. Northern BC medical systems threatens lives, critics say. Well, it does. Now, if you are a perfectly healthy person and you are a Canadian, more power to you. Great. Canadian medical care is going to be wonderful for you. If you're a sick person or you need something, you're really in trouble. One of my best friends, closest friends, is Mr. Justice David Brown, one of the Supreme Court of Ontario justices. His wife waited 2 years for knee surgery. Finally, he took her down to Texas and had the knee surgery done. Ontario, Canada. Fewer resources, longer waits, poorer outcomes. Now, you've often heard from Mr. Obama and from his people how the United States has the most expensive healthcare in the world, and we have the lowest life expectancy rates. How many people think that overall life expectancy rates are directly related to the quality of healthcare? They're not. They're not at all. And the WHO was always a champion of this. But then when they did some new statistics back in 2000, they said, oops. And you know that from 2000 onward, the WHO has not compared healthcare systems country to country. They said it was impossible. Even the liberal WHO got out of that business. Next. Life expectancy statistics are skewed. The US has a bit lower life expectancy than Canada. This has nothing to do with healthcare. We have a much more heterogeneous population. We have more murders, accidents, and violent deaths. When these are factored out, we have a 1 year higher life expectancy than they do in Canada. We just tend to be more violent. There are many reasons for that. Next. How do we fare? 5-year survival rates for men and women, all malignancies. The United States, the European Union, always higher in the United States. Next. Again, same thing. Next. Breast cancer survival, bowel cancer survival, heart attack, I don't think the United States is in there, but the United States is always the top. Next. Comparison of different countries for 5-year cancer rates of all types of cancer. Now, it would be much greater if they were only curable cancers in there, but they also included things that are not curable, and so it doesn't look as significant as it is. But next. What the British think. Die in Britain, survive in the US. James Bartholomew, a well-known author in Britain who wrote an article in The Spectator. I urge you to all look it up. Next. Rationing on steroids. Medicare cuts almost $600 billion, yet are your premiums going down? No, they're going up. Where is that $600 billion going to go? It's going to go to other people. So where are you? U.S. Preventive Services Task Force is going to look at comparative effectiveness, sets price on the value of each year of life, individually, based upon how much you are going to contribute to society in the future. Sound kind of like what happened in Nazi Germany? Depends upon many factors. If the treatment exceeds the value of your life by some mathematical algorithm, you can be refused treatment. Now, if that's not a death squad, but that sounds pretty bad to me. Next. Affects all providers, more rationing. Affects everyone. Accountable care organizations, ties reimbursements to quality measures. They're not my quality measures that I decide are quality. They're quality measures the government decides it can easily measure and therefore easily restrict payment if they're not met. Independent Payment Advisory Board, appointed by the President, confirmed by the Senate, power to make law without legislation. So we've seen that before with Medicare, and that is really scary. Next. Rationing on steroids. U.S. preventive non-physician, the President, and HHS will develop quality measures, guidelines, and outcome criteria for all doctors and hospitals for every condition. Why don't some of you grab a medical textbook? I mean, that's going to cost more paper than trees we have in all of Oregon, okay? Government will be in complete control. Next. Effects. Single payment to hospitals and large groups to include doctors, much more power to large hospital corporations. The left is always saying, we don't want big corporations because big corporations are mean and nasty and horrible. Build your own Boeing 747, I say. But what they're going to do is create larger and larger healthcare corporations that are going to be responsible to no one but the government. If you look back in U.S. history, it hasn't been capitalism that causes these conglomerations of huge companies. It's been government involvement in certain protectionism that causes these huge companies. Capitalism, by its very design, causes a larger number of smaller companies. It's the government that produced all of this. Doctors would depend on hospitals to disperse payments. So I'd go in to see a patient, and the hospital would decide whether to pay me. Government access to medical records. You will simply not have any privacy. You are not going to have any privacy. Don't be fooled. No illusion of privacy. Idiotic quality measures, individual doctors will have no say. Private practice will end. I don't think in the next 5 years you're going to see any physician in private practice. Next. What's the result of this going to be? Everybody's going to get a flu shot. Even if you're 19 years old, totally healthy. I mean, yes, some people die from the flu. It's pretty rare that a young, healthy person dies from the flu. But everybody will get a flu shot. But You won't get mammograms, you won't get prostate cancer screening, and you will not get cardiac intervention to the extent that it's gotten today. So many more cancers will be diagnosed late, then the gross adjusted value of your life will not warrant treatment. Costs for everything will skyrocket, as mentioned before, and with your gross adjusted value of your life, what are we going to do? Next. Abortion. Well, we're already seeing it. Even though abortions have gone down from the 1970s, I will guarantee there's going to be an uptick because Obamacare and the people associated with it are going to be in charge of educating you about your rights. Reduced conscience protection for doctors, we're already seeing that. Loss of religious liberty for persons and institutions. Doctors are already not allowed to suggest alternatives to abortion. I mean, I probably could have been sent to, I'm saying this and you can call the gun, I could probably have been sent to jail 100 or 200 times during my practice. One of the things that got me to quit my practice is that if a woman comes in and says they want an abortion, I don't have a right to offer alternatives. Now, I always did, and I always did something else that's illegal, refused to refer them for an abortion. That is illegal. So, anyway, well, and Bill Toffler and I used to joke that it's okay to go to prison as long as we're in the same cell, because I don't want to be anybody's girlfriend. These measures are always just the beginning. Anybody who thinks that what's in the Obamacare bill or a law is that's what it is, has got to be deluding themselves. The exemptions are up to the HHS Secretary Sebelius. So it's not even in the law. I mean, she can decide to exempt anybody. And who's she exempting? Well, you know who she's exempting. As doctors are no longer in control, so your doctor will have no say. More support for Planned Parenthood. That's what we need, don't we? More support. So abortion will increase. I will promise you that in the 5 years after the implementation of Obamacare, abortions will increase. I guarantee it. If I'm wrong, I hope to God I'm wrong, but it will. Next. More bad news. Some states passed tort reform with resultant decrease in costs of medical care. Obamacare nullifies the state law that was changed to decrease the tort expenses. Now, tort reform had no effect in any of the states that passed it on the amount that was paid to you for economic damages. That wasn't that. It was the $50 million that you would get because the doctor's an idiot. Well, I could get along on $5 million. There was no reason for that, and those were the things that are reduced. That goes away under Obamacare. Immediately, in those states that passed tort reform, you're going to see a rise in costs. Allows no limit, however, on lawyers' fees. Now, because those poor lawyers. And doctors will practice defensive medicine, costs will increase, and as costs increase, your access to medical care goes down. Next. Our dear leader's statements, as you know, I've got 2 daughters and I don't want them punished with a baby. That's what he believes babies are. Next. Obama's concerns, that's what Obama wants. I don't like to be paranoid. Until 2009, I really never was. I wasn't paranoid under Carter. I wasn't paranoid under Clinton. I am schizophrenically paranoid now. Next. Our concerns, that's the punishment. That's the punishment that he's concerned about as a punishment. Next. And we're also concerned with those people who have contributed to this country, who fought for this country, who raised us. They shouldn't be forgotten. Next. What can you do? You can contract with doctors outside of insurance. There is not a doctor in the country who would not say, hey, you can't afford it, pay me $5. Why don't they now? Why don't they now? Because it's Medicare fraud. Do you know that? If you come to me and say, I can't afford it, I'm losing my house, et cetera, and I say, don't pay me anything or pay me $5, how many of you knew that that is considered Medicare fraud? When they talk about fraud and abuse, some doctors are bad guys or bad women, but the majority of doctors commit Medicare fraud by caring for patients, which goes against the Medicare 160,000 pages of Medicare rules. Concierge practices where you pay yearly for unlimited medical care, consider foreign medical care for serious illnesses. Now, that's really becoming more of an option. Get everyone to vote. We could have had a different governor if all the Republicans got out to vote. We're all tired, we're sick of this junk, and we don't vote, and we need to vote. You need to go and get out the vote. Next. That's how my wife and I were just in India for her brother's son's wedding, and that's one of the hospitals. And the really good hospitals in India are just like the United States. The bad ones don't go to. Next. Medical tourism. They advertise. They'll pick you up at the airport. They'll give you a place to stay. They give you food. They do all sorts of nice things. So what are people doing now? your heart surgery is going to cost $150,000. So you talk to your insurance company and say, listen, I'll have it done in Bombay. You give me $40,000. So they give you $40,000 and call it good, say you can never have any more for this heart surgery. You go to Bombay and get it done, and how much is it? $5,000. And so you come home with $35,000. That's the kind of stuff that's going to happen. I'm going to do that as a profession. I'm going to get sick and go over there and make money. Okay, next. Website cost summary. They put a comma after the first number for some reason, $105,000 for, now the cost of the valve is extra, but if you need a triple bypass and blah, blah, $2,500. And I will guarantee you at the best hospitals there, it is every bit as good as here. Next. What will happen? Obamacare is the law. I do fear for a third term in one way or another. If history is our guide, there's going to be a crisis. There's going to be a bad crisis. And we got to look at history. We've got to look at history in total. One of my favorite examples is how many people know about the Polish-Lithuanian Confederation? All right, and you don't know about it. Do you know who Jan Sobieski was? Huh? Okay, Jan Sobieski was the democratically elected king of the Polish-Lithuanian Federation. It was the most powerful country in Europe at the time that the Ottoman Turks were trying to take over all of Europe. The Ottoman Turks laid siege on Vienna, and the Polish-Lithuanian Republic under Jan Sobieski and also the Holy Roman Empire, Jan Sobieski was the reason, defeated them and sent them packing. That was the end of the Ottoman Turks' attack on Europe and the beginning of the end of the Ottoman Empire. Now, Jan Sobieski is important. Why? Because that was a wonderful country. It's gone now. Why is it gone? The same reasons that will be gone. It's always the same. And so we need to realize that's the way things go unless we fight for liberty. We'll either choose the Constitution or the U.S. will disintegrate, Obamacare will implode, and government will take over completely. History doesn't lie. You need to be a student of history. Study the Polish-Lithuanian Federation or Confederation. It was a wonderful country. Would have liked to live there. Next. Most importantly, I think, prayer. Fight against the tyranny. Don't give up. Don't compromise your values. If we end up going to jail for our values, well, that's what we have to do. We must hang together or we shall surely hang separately. Next. Is that it? Okay. Well, that's all I can say. Am I under? Did I do it? I'm sorry I talked so fast. I was afraid of Linda. In years past, Linda has threatened me with implements. Linda, can we take questions?
Yes.
Okay. Yes, ma'am. Now, forgive me. I can't see a thing. My eyes have gone to heck, and I forgot my glasses. So, yeah.
You didn't mention anything about waivers. I understand there's quite a few.
Yeah, I did mention it. Waivers are, a lot of people are going to get waivers based upon the discretion of the Secretary of Health and Human Services. Waivers are being given for large unions because large unions contribute to the president. We don't know percentage, and there's nothing that specifies exactly the percentage or who's eligible in the law. Remember, it gives the Kathleen Sebelius or whoever takes over from her the power to decide that. And that's what the problem with these things is. It gives power to people to do whatever they want. You know, I think that's going to vary from state to state. And I think also that in my real world, in my perfect world, you would be cared for in whatever way we needed to, but you'd be responsible for your own pair of glasses. I mean, that's just the way I see things, and that's how we could fix this problem, because glasses don't break the bank. But under Obamacare, this is going to vary from state to state. Remember, the states are going to be administering the exchanges, and the nuts and bolts, as long as it follows Obamacare, are going to be via the state. I would say that in Oregon, if you can get an air conditioner, you can get a pair of glasses. You know. Yeah.
So are we not going to have catastrophic choices?
No, there will be no choice to have catastrophic insurance and HSAs under Obamacare.
So what happens to the HSAs now?
You'll probably for a time be able to keep your own private HSA, but I will promise you that that will end up going by the board. Yes, ma'am. No, ma'am. I didn't go to law school. But you know what? I mean, look, I think that the only thing that's going to change things is if we have an upswell of 100 million people who say enough is enough, find your money elsewhere.
And how do we do that?
I don't know. I'm thinking about that. I'm ruminating about that. You know, Martin Luther King, who's one of my heroes, I mean, I know I'm not black, but he's one of my heroes. And he said that we have no obligation None, same as Gandhi said, to obey unjust laws. We have an obligation to obey just laws. Okay. Yes, ma'am.
You mentioned about lupus.
Yeah, I mean, it's not, as far as I know, now it's, you know, there are a lot of changes that happen. As far as I know, that's not prohibited. If anybody knows differently, let me know. It will be. It certainly will be. What's going to happen is people, you know, if you drive down I-5, you'll see they're advertising MRI scans for $450. That's what, by the way, what the free market does instead of paying $2,000. Though I'm sure those will be stopped. I mean, I'm really sure. I was thinking of doing a concierge practice. I have a high level of guilt. So what happens is I knew that I would only be taking care of my wealthy patients, and all the people I really loved who were not wealthy, you know, they wouldn't be able to go to me. And so my wife said to me, Frank, you're never going to be able to do that. And, you know, so don't do it. Yes, ma'am. Well, I'm not saying they're not going to do any more cancer treatment. They're going to put you into some type of mathematical model, decide what your life is worth to them, and then decide what treatment. Look, in the last Oregon Health Plan, you had people who had cancer who were offered the suicide pill instead of cancer treatment. So look, nothing, when the government is in control, nothing is impossible. My projection is that all of those things, durable medical equipment, is going to be much harder to come by. And so, you know, people aren't going to be able to get, he might get one set, and then even though that set wears out, he won't get the second set. And I'm not saying that that's going to happen. I'm just projecting, based upon what I know, that it's going to be much harder to get those things.
My concern is he's going to constantly outgrow them.
Of course, yeah. They either wear out or you outgrow them. And so that's going to be a problem.
You probably tell him, no, we got you some for years.
I would say that that's going to happen, yes. I mean, I'm not guaranteeing that's going to happen. I'm not trying to scare people out of proportion to but look, you've got to look at history. What has happened in history? What happened in Tennessee Care? What happened under Romney Care? I mean, we can't just go at it blindly. We have to look at what happened in those things. Durable medical equipment was cut down by 50% within 2 years. Well, the office is closed, as you saw, but you can, I'll give you they can get a hold of me through Oregon Right to Life, okay? And you can send me an email. It's, you know, okay?
Dr. Rosenbloom, that's your last question. Thank you.
Sorry, no more questions. Thank you.